Now, let's walk through the steps a patient typically takes prior to seeing a medical provider. Prospective patients will first have to learn about the practice through some means, then take the step to contact the practice, schedule an appointment, come into the office, and go through the check-in process before being shown to a room and meet with the medical provider. Each of these phases of the first impression contribute to a prospective patient's perception of the practice and will make each of the following acts of the practice production easier or more difficult. Think about people in your life that left an impact on you the first time you met them. When meeting someone for the first time, you immediately have an inclination to either like, dislike, or be indifferent to the person. That inclination is not driven by a single factor. It is a combination of factors. When meeting someone, there is a handshake, a facial expression, and a statement. If I were to shake your hand while looking at the ground or paying attention to something else, and not stating my name, you would have a distinct impression of that interaction. But if I were to walk up to you, shake your hand while looking you in the eye, smiling, and say, "Pleasure to meet you, I'm Chris Gangnis. I believe you know Dr. Johnson. She and I worked together in the past. She had some great things to say about you and your practice." That would leave a very different impression on you and your feelings about me. The first impression of the practice production is very similar. You want to make sure the practice leaves a lasting, positive impression. The first time a patient hears about a practice can come from a few different means: an advertisement, walking by the location, word-of-mouth referrals from healthcare professionals, hairdressers, or directly from patients of the practice. There are too many different types of external advertisements to review in this segment, but we'll use print advertisements as an example. Print advertisements, such as magazines and newspaper ads, are display ads with one purpose: to get prospective patients to call, right? That is the basic goal, but it is important not to overlook the image that is conveyed by those ads. Ads build a prospective patient's expectations of the practice. An ad that is filled with text and coupons for different procedures may create the expectation that a practice is a discount, Walmart-type practice. And that will be what will come to be expected from the practice, and those Walmart shoppers will be the type of patients that you will attract. I personally have seen the gag reels showing images of Walmart shoppers, and I don't think that anyone in aesthetics wants to strive for that. I'm not suggesting that promotions or discounts not be mentioned in an ad, but the messaging associated with those promotions will mold both patient expectations and, over the long term, your patient database. Craft your messaging around the goals of the practice and think about the person that you want to attract to your practice and what is important to them. If you build a patient database around discounting, you will have patients that are looking for the lowest price and not the best service. Your ads should reflect the brand you are trying to build and the reputation that you want. Marketing is one of the most crucial elements of any successful practice, and there is way too much to review in this segment. I have a presentation just on marketing and what is important to consider when developing your marketing strategies.